Got it. Hello, everyone. Welcome to the Women's Foundation of Minnesota's Community Response Fund Grant webinar. My name is LaCora Bradford-Kesty, and I use she, her pronouns, and I'm the Director of Community Impact here at the Women's Foundation. Here is a slide of our amazing community impact team. When I say a team, it truly takes a village. So first we have Henna Elias, our grants manager. We have Erica Hidrola-Cuesta, our program officer. We have Isatu Shriek, our Window Weeks More intern. We have the amazing James Arroyo Miller, our program manager. We have Nina Robertson, our Director of Systems Change. And last but not least, to our amazing team, we have Elizabeth Salonga, our new Dr. Aretha Clark King Fellow.
Hi, everyone. And for today's webinar, we're going to cover information about what is the Women's Foundation of Minnesota. If you're new to us, welcome. We're going to provide a deeper understanding of the Community Response Fund. And then we're going to end with reviewing the application components, the online web portal process, and the grant timeline. So who are we? What is the Women's Foundation of Minnesota? We are a statewide community foundation with the mission to end systemic inequities and drive innovation for gender and racial justice. Our vision is to create a world of equal opportunity where all women and gender expansive people across intersecting identities and their families hold the power to create and lead safe and prosperous lives. And we do this with the values of hope, generosity, courage, inclusion, and belonging. On the right, you'll see that we have our new strategic plan that launched in April of this year. And this strategic plan came in response to really what's happening in community and listening to the underlying systems that we cannot miss when transforming and thinking about decision-making and leadership styles and philanthropic practices. Looking at the history of the foundation and also the historical bias within women's philanthropy, the foundation recognizes that there's a need for a different narrative and approach. So with this new 7-year strategic plan, we join to fight and realize that gender and racial justice is in the core of systems and structures and cultures that should serve all women, girls, and gender expansive people. And this is just a way of us starting with this new strategic plan, a practical step to equitably sharing critical resources to achieve justice and prosperity with all women and girls and their communities.
Thank you, Erica, for that amazing overview of the work that we do at the foundation. So let's get into it. So the Community Response Fund started as our COVID-19 Response Fund. And in our 4 rounds of grant making through the COVID-19 Women and Girls Response Fund, the foundation awarded more than $1 million to 80 amazing organizations across the state to address the needs of women, girls, and gender expansive people based on gender-based violence, older women, policymaking, and advocacy with the underrepresented communities, and the short-term financial support for everyday needs, including children, elder care, food, housing, transportation, health, and wellness. And so this year, our fund will really prioritize holistic well-being and reproductive justice in the response to assault on reproductive rights at the federal level and the increased demand faced by Minnesota healthcare providers. So our funds will support reproductive and healing justice as well as emergent community needs. And so the Community Response Fund has 2 big priorities. The first being to protect body autonomy and the full spectrum of reproductive care, including abortion access, healing, wellness, and wellness for women, girls, and gender expansive people. And the second priority, which is true to our emergent community needs, is to respond to those vital needs of communities, such as policies that violate human rights, general operating funding gaps, and post-pandemic response. Some helpful tips when thinking about applying for our community response fund is this intersectional equity framework. And so in 2019, the Women's Foundation expanded its mission to include racial equity, capturing the centrality of the intersectional equity framework. And this guides all of our internal and external work at the foundation. And so this framework is a power analysis to create the conditions so that all people have what they need to thrive. So philanthropy and organizations seeking to advance impact and equity must put intersectional equity into practice to create equitable access to rights, opportunities, and resources. So what do we mean by when we talk about these different identities? So looking at this diagram, one, we talk about gender. We need to ask, how are women, girls, men, boys, transgender, gender expansive people differently or disproportionately affected and represented? Look at race. How are Black, Indigenous, Latinx, and Asian Pacific Islanders differently or disproportionately affected, represented, or impacted? Again, how and why? Place. How are rural, suburban, urban communities differently or disproportionately affected? And then these additional identities around ethnicity, sovereignty, socioeconomic class, age, disability, LGBTQ plus and two-spirit, and immigration affected, represented, or impacted, how and why. And so to really hone in, intersectionality is the practice of examining the intersecting identities of people and communities and how it impacts their access to opportunity and well-being. And if you haven't gotten it yet, Audre Lorde has an amazing quote, which I think really sums up this intersectional equity framework. And she said, "There is no such thing as a single issue struggle because we do not live single issue lives," which means we need to continue to keep the work at the forefront and continue to hold it and have multiple systems approach to each of these things. We can't talk about safety without talking about how it affects economics, without talking about how it affects education, and so on. And so some questions to consider for your organization. Does the organization and the project respond to an urgent need or communities around Minnesota? Does the organization and the project use an intersectional analysis to find solutions? Next slide. So now we're going to talk about healing, holistic well-being, and reproductive justice. And so to ground you all, this is a newer impact area that we have launched in our strategic plan. And so the Women's Foundation of Minnesota talks about holistic well-being, including reproductive justice and healing justice. We can't have them separate, they're together. So mind, body, spirit, and community wellness are foundational to accessing opportunities, and it's essential to creating a state in which all people can be healthy, whole, and safe. And when we think about reproductive justice, it's based on the belief that all women and people who become pregnant have the right to have children, the right to not have children, the right to nurture the children that they have in a safe and healthy environment. And so the reproductive justice movement acknowledges the ways in which intersecting factors such as race, social class, limit the freedom of marginalized women to make informed choices about pregnancy, or birthing people informed choices about pregnancy by imposing oppressive circumstances or restricting access to services. So the reproductive justice framework encompasses a wide range of issues affecting the reproductive lives of marginalized birthing people, including access to contraception, comprehensive sex education, prevention and care of sexually transmitted infections, alternative birth options, adequate prenatal and pregnancy care, domestic violence assistance, adequate wages to support families and safe homes. So reproductive justice is based on the International Human Rights Framework, which views reproductive rights as human rights. And so this definition was formed by the Sister Song Women of Color Reproductive Health Collective. And next, when we talk about healing justice, again, this is super important, and you're going to see a beautiful video really speaking to this work. But it's an evolving political framework shared by economic and racial justice that recenters the role of healing inside, right, of liberation that seeks to transform, intervene, and respond to generational trauma and violence in our movements, communities, and lives to regenerate traditions of liberatory resilience practices that have been lost and or stolen. And so this definition really originated in 2005 from the Kindred Southern Healing Collective.
And so now we want to share with you all the data because the Women's Foundation leads its work with research and listening, and we conduct one of the state's leading research, which is our 2022 Status of Women and Girls Report in partnership with the Center on Women, Gender, and Public Policy at the U of M. And what the data has shown us from this recent report is that for economic security, it does affect health. And if we want more productive workers and better overall health, then we need every employer to provide paid family and sick leave. The data also tells us that the cost and access to healthcare create barriers to care. There is even greater barrier as we have disaggregated data within race for African American and Latina women in Minnesota. We also have seen that the mental health care is not equitable across race. Women and girls of color and Native American women and girls are less likely than white women and girls to receive therapeutic treatment for a variety of reasons, including limited access, cultural norms, lack of sufficient healthcare professionals, and lack of culturally sensitive care approaches. And part of this research also leads our policy and advocacy work that we support through our Young Women's Initiative, and our Young Women's Initiative cabinet members have helped pass this policy work in response to what's happening in community. And last year in 2021, the foundation helped pass the Dignity in Pregnancy and Childbirth Act, requiring hospitals to supply education on implicit biases and anti-racism training in hospitals with obstetric units and birth centers, as well as by improving the availability of doulas and midwives in underserved communities. And again, this is in response to what we hear and what we're listening to in our research and with our communities in dignity in pregnancy and childbirth, that Native American birthing people in Minnesota are 4 times more likely, and Black birthing people in Minnesota are 2.3 times more likely to die of pregnancy or childbirth-related causes than white birthing people. And that's just over 60% of these deaths that are preventable. So this is important to amplify in our research, and we hope to continue using our research to amplify the priorities in funding. So holistic well-being and reproductive justice, we've had the opportunity to fund this work in partnership with Dr. Joy Lewis, the founder of Healing Justice Foundation. Dr. Joy Lewis funds a network of local Black, Indigenous, and people of color healers who support Black women and their communities experiencing compounding traumas with strategies for holistic well-being. So Dr. Joy spoke with us, with our CEO and President, Gloria Perez, to address our collective need for truth, healing, and transformation. And here's what she said.
I'd love for you to share with us how we can create spaces of healing when we know that the world is so damaged, so hurt and broken at this point in time.
I would say that we start by creating those spaces within ourselves, right? This idea of radical self-care. And you know, when we talk, folks think, like, why start with radical self-care? But I think about my sister ancestor's quote, Audre Lorde, who says that caring for myself is not self-indulgent. It is self-preservation, and that is an act of political warfare. It says self-care is an act of political warfare. Like, We have to just pause and like think about that for a minute, right? How could self-care be an act of political warfare? Well, because the system, I would argue, doesn't want us well. If we're not well, we will turn on ourselves and turn on each other, right? When we're not well. And so there's this idea that if we practice radical self-care as resistance, we are actually building a space of healing within ourselves. So then when we enter into space, automatically that space becomes, we usher in a healing presence. We're bringing it with us, yes? And so then we're able to come into spaces, and it shifts the atmosphere because we're coming into those spaces already with this healing presence. So that's number one. I use this process that I created that's called the Orange Method, and it has 4 parts. Meditation, which is about getting grounded. Mindfulness, which is about getting present. Emotional liberation, which is about getting free, and conscious movement, which is about getting unstuck. And so what I encourage, even though like it's a process that I put together that's called the Orange Method, but it's not, the practices are not mine. They belong to all of us. They belong to our ancestors. Like, I didn't create meditation. It's been around for thousands of years. What I do is remind us that these practices are available to us.
Thank you. I know that the Women's Foundation.
I needed those reminders. And the important piece or the nugget that I always take from that conversation is it's the healing, right? And the act of self-care is political warfare. So I just want y'all to take a minute and continue to make sure that you do something for yourselves today. So I'm going to jump right in to talk about the grant type, eligibility, criteria, all the kind of like nitty-gritty things that you need to know. We're going to try to anticipate or questions that people might have. And so this grant is a 1-year investment of $10,000 in general operating support. The foundation also uses a participatory grant making committee to make funding decisions. So it's not myself or my team who are sitting here reviewing applications. We do a little bit of that, but it is the village, a collective of people coming together who have experience working in community and expertise making funding decisions. So when we talk about eligibility, what organizations qualify as eligible? So one, it's that driving innovative solutions that advance gender and racial justice by increasing access to community power and leadership, safety, holistic well-being, reproductive justice, and economic justice in Minnesota. It's leading programs operating in Minnesota that serve Black, Indigenous, women of color, and gender expansive people. It's serving Black, Indigenous, and women of color who live in rural areas that identify as LGBTQ and or live with a disability. And we highly encourage that if you work or serve with those individuals, or your organization does that type of work, to highly apply. We want to see you represented. Willing to submit a short learning evaluation at the end of each grant period. That's super important. We want to make sure that that we understand what's happening in the community with the grant dollars. We want to also align the Women's Foundation's mission, vision, and core values that Erica spoke about at the beginning of this work, specifically our values around hope, generosity, courage, inclusion, and belonging. And then lastly, we get this question a lot around, we serve a variety of folks. We don't have just specific programming for one thing. So if your organization is serving at least 50 to 75% of women, girls, and gender expansive people, please apply. We use a gendered lens and an intersectional lens in our programming and our work. And so we want to make sure that organizations that have that lens are committed to working with those groups and are advocates in the movement to create a place where all women, girls, and gender expansive people can thrive. Some criteria, I'm not going to read every single thing, and the eligible programs that include, and then non-eligibility, I'm not going to read every single thing, but I'm going to hit the highlights. So under criteria, Your organization should be in a stable condition. You should also demonstrate a commitment to gender and racial justice using a multi-issue, multi-solution framework, which is that intersectional equity framework that we have been hammering in, hopefully. We'll also like to talk about representation. So talk about your board, staff, and volunteers that represent the populations that you serve in decision-making roles in your organization. Under eligible programs, an eligible program means that nonprofit that has tax exempt or a school that operates in Minnesota. If you don't have a 501c3 status, unincorporated organizations with a tax exempt fiscal sponsor. So if you have a fiscal sponsor, you can use their 501c3 status. We totally accept that. Please apply. And also American Indian nations. Now, looking over to what's not eligible, this is important, and go through this list specifically on your own, but not eligible, one, fundraising events, individuals. If an event or an activity happened retroactively, that's not eligible. Scholarships to attend college or universities or technical certificate programs. And then a really important one, organizations that may be deemed discriminatory based on race, creed, color, ethnicity, national origin, religion, sex, sexual orientation, gender expression, age, physical or mental ability, veteran status, military obligation, immigration status, and marital status. Next slide.
Awesome. And now for timeline and selection criteria. So this application will be a rolling review process. And to get started, we ask that you submit a intent to apply form, which has the initial part of this request for proposal. It will ask you 1 to 2 questions already included in the overall proposal. And we just want to be sure that you are able to apply right away. We're not going to ask for any of the financials yet. This is just a short form for you to apply, and within 1 week of applying that form, our team will reply back with either a yes, you're eligible to complete the application in our portal, or no, and here's next steps to applying again if there is another opportunity. The deadline, once you, if you do receive an invitation to apply, once you submit your intent to apply form, the deadline is 2 weeks after receiving this invitation to apply. And then once you submit your application, we will have our participatory grant making committee, which LaCora shared a little bit about. They will be in charge of reviewing the applications that get submitted in our portal, and they will have a 2-week review time to look at those applications. And so once those 2-week review times have happened, then we will notify you about a decision. So this participatory grant making committee, they're the community power committee, and really they are our decision makers. They are made up of the community. We have representation from program alumni, grantee partners, long-term grantee partners, our community leaders, donor partners, board of trustees, and our foundation staff. And so they will be recommending funding based on the missions and goals and values of your organization and what you have guided in your proposal. And then the selection process will be that we will continue looking at these intent to apply forms, these applications on a rolling basis until funding is no longer available. And like I shared, our fiscal year ends in March of 2023. So that's when the last month of funding will be for this fund. And then what else? Yeah, that is the timeline so far. Let me go to the next slide. The application process and components. So we have a online submission through our web portal. We have in the proposal, we have 4 components: the information about your org, or asking for just the over information, which is already in the intent to apply form. We have the project proposal description, these 3 questions. So answering in 1 to 2 paragraphs about your organization's mission, goals, major programs, and their participants. We ask for you to give a brief description of how the grant funds will be addressed in this emergent urgent need, and what are those outcomes. And then we ask that you also tell us who is implementing the proposed work, including the plans to add staff or assign duties to current staff. And this just helps also understand with capacity of the work that you're doing. There's also going to be a demographic survey. This is just collecting the demographics of the individuals and communities impacted, so that we understand as a whole how your organization is leading. And then there will be some attachments to include that will have, will ask for financial statements and a list of staff information. So these are the 4 components of the application. Again, to get started, we ask that you submit an intent to apply form that will help us determine if you are eligible to apply. And then some helpful tips is that once you do receive an invitation to apply, to use your intent to apply form answers, because that was the first part of the application. You can copy and paste your answers from there to the grant portal application. And then also, like Cora shared, the intersectional equity framework is important to guide your application. That is one of the pieces that our committee members use to base their funding recommendations. Registration to our grant portal. So once you are determined eligible to apply, and you receive an email from us to apply on our grant portal and complete the application, this is the process for first-time users. So if you're new to using our portal, you would go to this link in our website. You put in your information. The best way to access this portal has been using Google Chrome as a browser, or Firefox. Once you complete your information, please select Grant Applicant for your portal access. And then after you complete the required fields, please make sure to check off accepting the terms and conditions. This process of creating an account, we ask that you please do it in advance, because it will take a few days for us to look at your registration and approve it in our system, so that you can access the grants on the web portal.
Thank you, Erica, for walking us through that. Just really quick, I'm going to reiterate what the awesome and amazing Erica said. So applications are open. This is a rolling grant. Please apply using the intent application. Once submitted, we will determine if you are eligible or not. If eligible, we will send you the rest of the application to complete in our grant portal. You have 2 weeks to complete that by 11:59 p.m. Please make sure that all of those materials are completed and ready to submit before you hit send on the application portal online. And then if you have any issues accessing the grant portal or need some technical assistance, Hannah Elias from our amazing team, hi Hannah, will assist you. Hannah is super responsive. And if you have a program related question about like what you're about to apply for, if you needed more context, Erica Hidrola-Cuesta, our amazing program officer, would be happy to support with any of those types of questions. And finally, please stay connected to the Women's Foundation of Minnesota. Here's all of our amazing handles. We're on Facebook, we're on Instagram, we're on Twitter, we're on LinkedIn, we're on YouTube. We would love to stay connected with you all. We have quarterly Community Connect events. We host amazing listening sessions and panel conversations in community. We lead the state's research on women and girls. And so if you don't know, now you know. So please stay in touch with us. And we can't do this amazing work without you all. So thank you.
Thank you, everyone.